This boy is only 15 years old, but he is extremely tall with a height of 198 cm, and his diagnosis is spear chicken breast. We operated on him today. Do you want to know the results of the surgery? The child was born with no chest wall abnormalities. At the age of 2 years, a mild depression of the anterior chest wall began to appear, and after 2 years, it became a bulge. It was not severe in the early days, but it became noticeable, and the shape changed accordingly. In the early stage, it was only a simple protrusive deformity, and then gradually depressed on both sides of the chest wall. There was no discomfort, but the patient was dissatisfied with the appearance of the chest wall and felt severe inferiority. The height of the patient was significantly higher than that of children of the same age. Especially in the last year, his height suddenly increased significantly, and the deformity also worsened rapidly. Members of the mother's family are generally taller but have no history of thoracic deformity. In order to completely treat the deformity, the patient was admitted to our hospital a few days ago. Physical examination on admission showed that the patient was tall and thin, with a height of 198 cm and a severe deformity of the anterior chest wall. The middle of his chest protruded forward, diagonally underneath it. The lower part of the chest wall on both sides was thickened, and no heart murmur was heard. Imaging examination showed the middle protrusion of the anterior chest wall, with the highest point near the xiphoid process. The costal arch depressed, the heart in medial position, and no abnormalities on cardiac examination. The patient had a clear diagnosis of the severe chicken breast or pectus carinatum with indication for surgery and no contraindications. After adequate preoperative preparation, the surgery was performed under general anesthesia. In the supine position, 2 incisions were made in the lateral chest wall respectively, and a Wilhelm procedure was performed first to eliminate most of the protrusive deformity, and then one procedure was performed to correct the residual deformity. The operation was went smoothly, and satisfactory results were evident. Chicken breast are common thoracic deformity characterized by the protrusion of the anterior chest wall. Because the chest wall does not put significant pressure on the heart, there are usually no obvious symptoms. However, due to severe deformity of the appearance, it can have serious psychological impact on the patient. This patient had low self-esteem and significant psychological implications, so he was eager to undergo surgery as soon as possible. There are many options for chicken breast surgery, with the early ones being open surgery. Due to lung scar and lung damage, it has been replaced by minimally invasive surgery in recent years. There are currently 2 popular methods in clinic practice. One is the so-called antenar surgery, and another is Wilhelm procedure. In contrast, the Wilhelm procedure is a very simple and extremely effective procedure that can be used for all types of protrusive deformities, including chicken breast. In this patient's surgery, we used Wilhelm procedure. The intraoperative operation was very simple, no complication occurred, and the operation was successful. In the past, we have performed a large number of chicken breast surgery in the world. Of all these patients, this patient is one of the most severe deformities. The case with such severe deformity can be corrected is a strong testament to the effectiveness of Wilhelm procedure. In the future, we will continue to optimize this surgery to relieve the pain of more patients. I'm Dr. Wang from China.